Hi everyone, my name is KashariDavis and my presentation is on BPH. BPH stands for benign prostatic hyperplasia. What is BPH? BPH is prostate gland enlargement. It is a common condition that men get as they age. Here I have a picture of what a normal prostate looks like and what an enlarged prostate looks like. To the right, the picture to the right is an enlarged prostate, and you can see that it's impeding urine flow from the bladder because it's so enlarged. What can happen? An enlarged prostate gland can cause uncomfortable urinary symptoms such as blocking the flow of urine out of the bladder. It can also cause bladder, urinary tract, or kidney problems. What are the symptoms of BPH? Well, some of the symptoms of BPH include frequent or urgent need to urinate, increased frequency of urination at night, also known as nocturia, difficulty starting urination, weak urine stream or a stream that stops and starts, dribbling at the end of urination, inability to completely empty the bladder. Those are some of the symptoms. And here I have another picture that just shows like an X-ray, I guess you would say, of the prostate. And I tried to find a picture of the actual surgeries or one of the actual surgeries that they use to treat BPH, but this is the only thing I could find under that category. Other possible symptoms. Less common signs and symptoms include urinary tract infection, inability to urinate, and blood in the urine. The size of the prostate doesn't necessarily determine the severity of your symptoms. Some men with only slightly enlarged prostates can have significant symptoms, while other men with very enlarged prostates can have only minor urinary symptoms. And some men, symptoms eventually stabilize and might even improve over time. Other possible causes of urinary symptoms include urinary tract infections, inflammation of the prostate, prostatitis, narrowing of the urethra, like a urethral stricture, scarring in the bladder, neck as a result of previous surgery, bladder or kidney stones, problems with nerves that control the bladder, cancer of the prostate. The prostate gland is located beneath your bladder. The tube that transports urine from the bladder out of your penis is the urethra, passes through the center of the prostate. When the prostate enlarges, it begins to block the urine flow. Most men have continued prostate growth throughout life. In men, this continued growth enlarges the prostate enough to cause urinary symptoms or to significantly block urine flow. It isn't entirely clear what causes prostate enlargement, but research has shown that it may be due to changes in the balance of sex hormones as men grow older. Some of the risk factors for BPH is aging, family history, diabetes, and heart disease, and lifestyle. Aging. The prostate gland enlargement rarely causes signs and symptoms in men younger than age 40. About 1/3 of men experience moderate to severe symptoms by age 60, and about half do so by age 80. Family history. Having a blood relative such as a father or a brother with prostate problems means you're more likely to have problems. Diabetes and heart disease. Studies show that diabetes as well as heart disease and the use of beta blockers might increase the risk of BPH. Lifestyle. Obesity actually increases the risk of BPH, while exercise can lower your risk. Some of the complications of BPH include sudden inability to urinate, urinary retention, urinary tract infections, bladder stones, bladder damage, kidney damage. Urinary retention, you might to have a catheter, like a Foley catheter, inserted into your bladder to drain the urine. Some men with an enlarged prostate need surgery to relieve urinary retention. Urinary tract infections. Inability to fully empty the bladder can increase the risk of infection in your urinary tract due to the urine just sitting in your bladder. And we all know if you just let anything sit out, like even if you leave a drink out for too long at room temperature, just sitting on the counter, you're going to start seeing some bacteria or mold or some type of growth in there. And the same thing happens when you think about the bladder. It'll make an infection occur. If UTIs occur frequently, you might need to get surgery to remove part of the prostate. Bladder stones. They are generally caused by an inability to completely empty the bladder. Bladder stones can cause infection, bladder irritation, blood in the urine, and obstruction or urine flow. Damage to the bladder. A bladder that hasn't emptied completely can stretch and weaken over time. As a result, the muscular wall of the bladder no longer contracts properly, making it hard to fully empty your bladder. And kidney damage. Pressure in the bladder from urinary retention can directly damage the kidneys or allow bladder infections to reach the kidneys. Diagnosis. Physicians or advanced nurse practitioners or advanced care practitioners diagnose BPH by digital rectal exam, which we all have done in this course when we went to emerging. The doctor or practitioner, advanced practitioner, inserts a gloved finger into the rectum to check your prostate for enlargement. Or they do a urine test. Analyzing the sample of your urine can help rule out an infection or other conditions that can cause similar symptoms. Blood tests. The results can indicate kidney problems. Or PSA, the prostate-specific antigen blood test. The PSA is a substance produced in your prostate. PSA levels increase when you have an enlarged prostate. However, elevated PSA levels can also be due to recent procedures, infection, surgery, or prostate cancer. Additional tests. Additional tests that are ordered to rule out or to find out if you have BPH is urinary flow test, post-void residual volume test, 24-hour voiding diary, transrectal ultrasound, prostate biopsy, urodynamic and pressure flow studies, and a sorry, I'm like bad sometimes with these words, but cystoscopy, which is a lighted, flexible instrument, cystoscope, which is inserted into your urethra, allowing your doctor to see inside your urethra and your bladder. You will be getting a local anesthetic before the test. The urinary flow test is where you urinate into a receptacle attached to a machine that measures the strength and amount of your urine flow. Test results help to determine over time if your condition is getting better or worse. Post-void residual volume test. This test measures whether you can empty your bladder completely. The test can be done using ultrasound or by inserting a catheter into your bladder after you urinate to measure how much urine is left in your bladder. And the 24-hour voiding diary, recording the frequency and amount of your urine might be especially helpful if more than 1/3 of your daily urination output occurs at night. And the transrectal ultrasound is an ultrasound probe which is inserted into your rectum to measure and evaluate your prostate. Prostate biopsy. This is where A transrectal ultrasound guides a needle used to take tissue samples, biopsies of the prostate. Examining the tissue can help practitioners diagnose or rule out prostate cancer. And the urodynamic and pressure flow studies is where the catheter is threaded through your urethra into your bladder. Water, or less commonly air, is slowly injected into your bladder, and the doctor can then measure bladder pressures and determine how well your bladder muscles are working. These studies are usually used only in men, but suspected neurological problems and in men who have a previous prostate procedure and still have symptoms. Treatment. Medication is the most common treatment for mild to moderate symptoms of prostate enlargement. These medications include alpha blockers. These medications relax the bladder, neck, muscles, and muscle fibers in the prostate, making urination easier. And alpha blockers, which include alfuzosin, doxazosin, Flomax. That's the one that's mostly prescribed. I've seen that prescribed mostly in the hospital, and even when I did my clinicals in like a clinic, that is the medication that's like the gold standard or mostly used. And Sedosin, I've seen that prescribed. They usually work quickly in men with relatively small prostate. Side effects could include dizziness, so you need to be careful about that, especially if they're already on blood pressure medications. And a harmless condition in which semen goes back into the bladder instead of out the tip of the penis, retrograde ejaculation. So that's another side effect that you might have to look out for, like if the patient comes back and you're reevaluating how the plan is going on the medicine and they start telling you some of these symptoms, it could be due to the fact that they're now taking this alpha blocker. Then they have another class of medications called the 5-alpha reductase inhibitors. These medications shrink your prostate by preventing hormonal changes that cause prostate growth. These medications, which include finasteride or Prozacar, I've seen that used. That's like the second gold standard. And Avodart might take up to 6 months to be effective. Side effects include retrograde ejaculation. Combination drug therapy. Sometimes the doctor might recommend taking an alpha blocker and a 5-alpha reductase inhibitor at the same time if either medication alone isn't effective. And then they have another medication called tadalafil. And studies suggest this medication, which is often used to treat erectile dysfunction, can also treat prostate enlargement. Other treatments that are used if you have severe prostate enlargement and having like severe issues, chronic UTIs and things of that nature, is surgery along with lifestyle home remedies. Some of the surgeries that are done for this condition are, of course, we all have heard of the TURP, the transurethral resection of the prostate. And this is where a lighted scope is inserted into your urethra, and the surgeon removes all but the outer part of the prostate. The TURP generally relieves symptoms quickly, and most men have a stronger urine flow soon after the procedure. After TURP, you might temporarily need a catheter to drain your bladder. Oh Lord, and they do continuous bladder irrigation in the hospitals after some patients have this procedure. If they're having a lot of clotting and blood coming out, they do like something called a continuous bladder irrigation just to irrigate the bladder, get the clots out, clear up the urine, get the blood out, and make sure the patient is stable enough to go home after that procedure. And then another surgical procedure is called TIP, which is a transurethral incision of the prostate. And they use a lighted scope to insert into the urethra, and the surgeon makes one or two small cuts into the prostate gland, making it easier for urine to pass through the urethra. This surgery might be an option if you have a small or moderately enlarged prostate gland, especially if you have health problems that make your surgeries too risky. And then they have the transurethral microwave thermotherapy, TUMT. This is where your doctor inserts a special electrode through your urethra into your prostate area. Microwave energy from the electrode destroys the inner portion of the enlarged prostate gland, shrinking it and easing urine flow. This procedure might only partially relieve your symptoms, and it might take some time before you notice results. The surgery is generally used only on small prostates and special circumstances because retreatment might be necessary. And then they have something called the tuna, which is a transurethral needle ablation. In this procedure, a scope is passed into your urethra, allowing your doctor to place needles into your prostate gland. Radio waves pass through the needles, heating and destroying excess prostate tissue that's blocking urine flow. Tuna may be an option in select cases, but the procedure is rarely used any longer, so they don't really use that procedure any longer. And then the laser therapy. A high energy laser destroys or removes overgrown prostate tissue. Laser therapy generally relieves symptoms right away and has a lower risk of side effects than does non-laser surgery. Laser therapy might be used in men who shouldn't have other prostate procedures because they take blood thinning medications. The options for laser therapy include ablative procedures. These procedures vaporize obstructive prostate tissue to increase urine flow. And then they have the elective procedures, such as holmium laser inoculation of the prostate. They call it HOLEP. And this procedure generally removes all the prostate tissue, blocking urine flow and prevent regrowth of the tissue. And then they have something called the PUL, it's PUL, and it's the prostatic urethral lift. And they use special tags to compress the size of the prostate to increase the flow of urine. And this procedure would be recommended if you have lower urinary tract symptoms. And it can also be effective and offered to some men concerned about treatment impact on erectile dysfunction and ejaculation problems. And then they have embolization, and that's an experimental procedure where the blood supply to or from the prostate is selectively blocked, causing the prostate to decrease in size. Long-term data on the effectiveness of this procedure aren't available. Then they have the open or robot-assisted prostatectomy, where the surgeon makes an incision into your lower abdomen to reach the prostate and remove tissue. And this is generally done if you have a very large prostate, bladder damage, or other complicating factors. The surgery usually requires a short hospital stay and is associated with a higher risk of needle or needing a blood transfusion. Probably because you lose so much blood and you become anemic, so that's why they have to keep you in the hospital a little longer, and you might need a blood transfusion. And that's really it. So we went over everything, the meds that you can take, the different surgeries there are, which there are a lot, as you can see what I have went over. And the last thing that we did not touch, which is something that the patient has to do at home, is lifestyle and home remedies, but it's still important to tell the patient about lifestyle and home remedies to help control the symptoms of an enlarged prostate. They can try to limit beverages in the evening, limit caffeine and alcohol, limit decongestants or antihistamines, because those drugs tighten the band of muscles around the urethra that control urine flow, making it harder to urinate. Oh gosh, that happened with me with, of course I'm a woman, I don't have prostate issues, but I didn't even know until after I became a nurse, when I was taking Benadryl one time, that they can cause urinary retention. So I imagine what Benadryl can do to an older man who has BPH issues. And then schedule bathroom visits and following a healthy diet, because obesity is associated with enlarged prostate. And stay active. Just tell the patient that they can stay active, because inactivity contributes to urine retention. Even a small amount of exercise can help to reduce urinary problems caused by an enlarged prostate. Urinate and then urinate again a few moments later. This practice is known as double voiding. That can help with the symptoms of an enlarged prostate. And keep warm. Cooler temperatures can cause urine retention and increase the urgency to urinate. And that's really it. So we went over everything that you can possibly do to treat it, BPH. So now we have an in-depth idea of BPH, how we can treat it as practitioners. Yeah, that's really it. So if you have any questions, just send me an email and just let me know. Thank you.